presenting this on behalf of the research team at the University of Western Cape, as well as University of Pretoria. Our aims and objectives now, we wanted just to find out how these major global health initiatives have affected the health systems, but at the same time with some focal areas which we're focusing on within the health systems, mostly the HR policies, the planning, the management, service delivery at the lower levels. And this process was meant to help us identify key lessons that could be used by both the government and other stakeholders in improving health system and delivery of HIV services, as well as just the overall understanding of how global health initiatives operated in South Africa. Did research from the worst affected to the least affected. KZN is one of the worst affected, the high rate of HIV/TB, and Western Cape is one of the lowest in the country. So that comparison also gave us some differences on how GHI is operated. Focus again of the presentation, we're also trying to, as much as find out how the GHI is operated and how they affected the health systems, but also looking at how can these interventions be sustainable? Are they sustainable or not? What can be done then to work together to make them sustainable? And one of the key findings which we found from our participants was that as South Africa is already known, it has very limited donor funding. It's not as highly dependent on donors than our other participating countries. It is on average around 1% of overall health budget coming from donors. The rest comes from the government. But the situation is different for HIV. We have a larger percentage of funding coming from donors. But because of that history of low funding, it also created the impression that whatever donor funding which we were getting was very insignificant. And this had an effect on sustainability plans. Because the perception which we had at national level, people were saying, wow, South Africa does depend on donors, so we shouldn't worry that much about sustainability plans. But we found when we went down to the lower levels, province, district, sub-district, we found that there was a lot of donor-funded activities. And there was a lot of money being put into HIV programs at lower levels, which was supposed to mean that the government was supposed to also think about how to sustain those in case funds run down. This is more like an indication of the amount of funding that has been put into the South African government from the two major donors. You see, a lot of funding there comes from PEPFAR, and then a larger percentage from the Global Fund. And there's also been evidence that has shown that PEPFAR has supported a lot of facilities in the poor, especially the more poor resource provinces like KZN and Eastern Cape. One of the key problems again was harmonization of all, with a lot of PEPFAR finance, global finance programs working in South Africa, but they were not working together. So it also created the problem that they are all working separately. They couldn't share, they were not sharing their information. They were not also working together, even working within the same district. But things are changing now. So we need more collaboration to make these programs more sustainable.